If you look from other countries, America is often seen as a beautiful place where almost all problems are solved. And the main thing that remains is to combat injustice towards various minorities. As is often the case, behind the glossy facade are areas where you wouldn't want to live. We will definitely talk about this in this video. Like, subscribe to the channel, and we continue. One of these areas is located in the state of Louisiana along the Mississippi River, between Baton Rouge and New Orleans. The stretch of nearly 87 miles locals sometimes call the Chemical Corridor, but the second name chills the blood no less. This area is better known worldwide as Cancer Alley. Once upon a time, there were green corn cane fields here. The air was clean, fresh. Locals made a living by fishing, which almost jumped into their hands from the rich waters of the Mississippi. But the development of the petrochemical industry forever changed the face of this area. The first wave came in the late 1940s. Tax incentives attracted major industries to the state. Chemical plants were initially built around Baton Rouge and New Orleans. But gradually they began to spread farther and farther along the Mississippi River, which served as a convenient transportation corridor for the transportation of raw materials and finished products. Since ancient times, a significant portion of the local population here has been African American. Their ancestors were once slaves on this land. Initially, they even welcomed the appearance of factories, thinking they would get better jobs than they had before. Their naive dreams were shattered by harsh reality. Factory owners brought workers with them, most of whom lived in remote areas away from the polluted zone. At that time, they refused to hire locals, finding various reasons. In the 1980s, there was a second wave of mass influx of environmentally polluting enterprises. But for local residents, little changed in terms of employment. Their average income level remained one of the lowest in the country. So, in Cancer Alley there is a town called St. Gabriel. Its population is about 6,500 people. In the mid-1990s, a study was conducted regarding the employment of St. Gabriel residents. It turned out that they occupied only 9% of full-time jobs. At the same time, every new factory coming to these lands promised jobs to the town's residents. Naturally, no one rushed to fulfill the promises later. The mayor of St. Gabriel believes that the real reason why companies don't want to hire people living close to the plants is the high risk that such workers will be greatly concerned about environmental pollution issues. The appearance of some local towns is distressing. Poverty is visible to the naked eye. Small one-story houses look unattractive. There is a lot of garbage in the area. Many buildings are not being repaired. Piles of branches and parts of buildings scattered after hurricanes are not cleaned up for years, and industrial landscapes and smoke in the sky do not add positivity to this already bleak picture. You probably already understand why this stretch along the Mississippi River is called Cancer Alley. The thing is, since the mid-1980s, residents of towns near chemical plants have noticed an abundance of cancer cases. Journalists could not help but notice this pattern, and the eerie nickname stuck to this place. Subsequent studies have shown that among some groups of the population, there is an abnormally high incidence of lung, stomach, and kidney cancer. Statistical data vary, but according to official figures, the mortality rate from cancer in the state of Louisiana is 15% higher than the national average. Most likely, the lion's share of the sick resides precisely in the industrial zone of the state. But there is another statistical problem. It lies in the fact that people living in the vicinity of petrochemical plants do not seek medical help before death due to financial or social reasons. For example, in the aforementioned St. Gabriel, about 20% of the population lives below the poverty line, one of the worst rates in the country. All of this plays into the hands of industrialists who are interested in reducing the actual number of cancer victims. But there are places where mortality due to oncology exceeds all indicators. In the very heart of the ominous alley lies the 10,000th city of Reserve. It holds a sad record. Here, the risk of getting cancer is the highest, 50 times higher than the American average. Almost every local family has someone who has already died from this terrible disease or is still fighting it. For a long time, residents only complained about periodic bursts of chemical smells and joked about ailments. Only in December 2015 did the Environmental Protection Agency of the United States present a report on air toxicity. Unfortunately, while the report opened the eyes to what was happening in the city, it did not significantly improve the lives of its inhabitants. Essentially, they still have only 3 ways out of the situation: to get sick, to die, or to leave. So, at the first opportunity, people flee from gloomy towns because there is no sense in such existence. Along the 137 kilometers of Cancer Alley, there are about 200 enterprises processing such toxic chemicals as oil, ammonia, chlorine, producing chemical fertilizers, plastics, and pesticides. In total, this small area accounts for 25% of all petrochemical production in the United States. Meanwhile, the states occupy 1/5 of the entire global market. It is clear that the Louisiana industrial cluster can easily compete with the largest states in terms of petrochemical production volumes. The density of enterprises is so high that the industrial landscape is almost continuously observed over a distance of 140 kilometers. One can only guess at the volume of harmful substances that reach this land and air. In total, about 400,000 people are exposed to the negative impact of enterprises directly attributed to Cancer Alley. The majority of them are African Americans. These data are provided by Climate News Insight, a non-profit news organization specializing in environmental journalism. These data vary greatly from publication to publication, but it should be understood that those living in close proximity to the enterprises are most affected. Cancer Alley remains a real paradise for those who want to build a chemical plant, and the more, the better. There is plenty of cheap land here, ideal for large facilities. As a bonus, easy access to waterways is provided. Government officials are pleased with the investments from industrialists, equating their presence to progress. But in reality, local residents do not get jobs. Tax incentives for factories do not significantly fill the state budget, and the ecology in the industrial zone leaves much to be desired. Thus, despite being the second largest producer of petrochemicals in the United States, Louisiana is considered one of the poorest states in the country. Apparently, officials are only concerned with the interests of the enterprises, which, in turn, manage to capture their attention, and the fate of the local population is of much less interest to them. In 2021, Joe Biden issued an executive order aimed at protecting public health and the environment, as well as addressing the climate crisis. When signing it, the president separately mentioned Cancer Alley. Formally, the area seemed to have hope for positive changes, but somehow it seems that if a bright future ever comes, it will be largely due to the efforts of local activists rather than politicians. That's all, folks. Hope you found it interesting. Share this video, write your opinion in the comments. See you soon.